Hello, my name is Nicholas Fannin, and I am an MBA student at the University of Findlay in Findlay, Ohio. As a 23-year-old MBA student, I can say that the Affordable Care Act has positively affected me. With the Affordable Care Act, I am now able to stay on my parents' health insurance plan, which is sponsored by the Union Iron Workers, which is a national group of union members who all have the same insurance, which allows me to have a $70 per month charge with a $400 deductible and a $2,000 family deductible, which is considered very good for current insurance. And as a grandfathered plan, I have been lucky that we have been able to keep the low deductible, low benefit amount plan. It is sponsored by Anthem Blue Cross and Blue Shield, which is one of the healthcare leaders today. My current employer, Smith's Pharmacy and Home Medical in Portsmouth, Ohio, offers a health insurance plan. It is also offered through Anthem, but since we only have 47 employees for 3 locations, we have a very high deductible at $3,500 per year, as well as a very high premium every month. It is effectively right around $20 per week or $80 per month, which is actually more expensive as far as the premium and more expensive as the deductible compared to my current insurance. So I was lucky enough to stay on my parents' insurance. And then also in the future, I can see that it may affect me after I turn 26, or in the event something happens to the Affordable Care Act and it is no longer in effect. But for the time being, I am doing okay with the Affordable Care Act. My insurance has not changed. Nothing has changed, even down to the doctors I visit or the copays that I pay at the doctor's office or the pharmacy. Now, as far as for my person that I'm interviewing today, his name is Brent Hill, and he also works at Smith's Pharmacy and Home Medical, and his experience is just a little bit different.
Hi, my name is Brent Hill, and I'm the Marketing Director for Smith's Pharmacy and Home Medical in Portsmouth, Ohio. We are a small, family-owned and operated independent pharmacy and home medical company that's been around since 1925. The ACA has affected me personally and business related. First, personally, I am a healthy 30-something male who used to be able to get insurance for anywhere from $80 to $100 a month, just because I'm not at a point in my life where I need, annual exams, stuff like that. Now, with the ACA and the healthcare exchange, I have been grouped in to the rest of the populace. So a healthy young male now, my rates are quadrupled. I'll spend anywhere from $320 to $400 a month. And that's just absurd. There's tax credits, there's everything, but you're not guaranteed those credits. And at the end of the day, $400 a month, that's just insane. $4,800 a year is a bit much for health insurance. And it levels the playing field for a lot of people. So there is good, but to punish everybody for it, it hurts. And when you're having to make decisions like paying your insurance or your electric bill or stuff like that, it's really not a good situation. So personally, it has hurt me insurance-wise. Luckily, my company does provide insurance, which gives you breaks. But if I were to be in the same boat as the majority of Americans and getting into the exchange, yeah, that's just absurd. It's too much money. Business-wise, being in the healthcare field, when they said that it would push more people to, get insurance, which would help everybody out and just, make a healthier population, that's great in theory, but things don't always work that way. And, yeah, it pushed people to Medicaid majoritively rather than private insurance, which is good, you think. Oh, that's great, we accept Medicaid. The problem is so many people have gone to it, and the government's trying to cut, cut back, tighten their belt. So now we have a situation where we have to jump through hoops just to prove that customers are in need of certain equipment, certain medications, and we have to contact the doctors and do extra steps where before we didn't have to. And they say, of course, it's for oversight and just to make sure that the customer's getting the best care possible. But in reality, it hurts because it makes their care harder to obtain. It makes them go through more steps. It stresses them more. And it takes their choice away. Now they're getting pushed to certain doctors, to certain specialists, when there may be somebody that they've gone to their whole life, but they're not allowed to anymore. So, from a business perspective, it has limited us. It has cut back the amount that we are reimbursed by the government, by insurance companies. And really, it's taking your choice out of your own health care. And as far as I'm concerned, you should definitely have your own choice in your own health. That should just be a basic right in this great country that we call America. Anyways, that's my spiel. Again, I'm Brent Hill, Marketing Director from Smith's Pharmacy and Home Medical in Portsmouth, Ohio. Thank you for your time.
As you can see, everyone has been affected by the Affordable Care Act in a little bit different way. From some people having higher premiums and higher deductibles to some people being able to keep their lower premiums and lower deductibles, there really isn't a middle ground that many people are able to rest on. Some people either have a higher deductible than they had or a lower deductible than they had. Nobody's really stayed the same, but I'm one of those few lucky individuals that has stayed relatively the same throughout the whole process, and hopefully it can continue to stay the same. But with the legislation that has been proposed here in the past couple of months, with the overturning of the Affordable Care Act, which is highly unlikely but feasible at this point, it remains to be seen what the future of the Affordable Care Act is. Thank you for watching.